Great. Thank you guys for your patience there. Some technical difficulties, never a great way to start, but in any instance, it's just fantastic to be back again after so many years. It feels like we were just yesterday. I feel like I remember the hop on and hop off bus so clearly from only a few years ago, but then I was doing some rough math in my head yesterday, realizing that it was not just a few years ago. So in any instance, it's really great to be back and to speak a little bit about companion animal welfare, what that means, how we aim to achieve it, and some of the developments that we've seen in the field of managing street dog populations and improving community health for pets. So I'm excited to be here today also with my colleague, Dr. Amit Chaudhary, who is our director of our Monitoring Impact Evaluation team at Humane Society International. So what does that mean? Well, Dr. Amit is everything data. So if you are in the field of managing dog populations or trying to provide direct care or wanting to monitor and evaluate the impact of your programs, he's our guy. So if you have any questions, he'll be speaking a little bit about how we use data to drive our programmatic decisions. And so you'll be hearing from him in a few minutes. So I'm really excited also about the theme of this conference being education and engagement because it speaks so truly to our mission at Humane Society International and the work that we do. So for those of you who are not familiar, just a really quick overview of the work that HSI does. We are a global charity with a heavy footprint in Asia. We have worked for more than 2 decades on finding culturally appropriate and relevant solutions to building community capacity, working with government stakeholders, running large volume spay-neuter programs, and training veterinarians around the world. We've trained hundreds of veterinarians, reached hundreds of thousands of animals, if not millions of animals. Just a quick map of where some of our programmatic work is for dogs and cats, recognizing that we have farm animal programs and wildlife programs around the world, but this really just captures our dog and cat work where we have ongoing sustainable programs. Now you'll notice again that we do have a heavy footprint in Asia, but this presentation actually isn't about Asia. This presentation actually focuses somewhere much different. This presentation is focused more on South Africa. And so you might be thinking, well, like, why South Africa? Clearly, you're at the wrong conference. But what I will say is that even though it's a different continent, many of the problems are the same, right? When I go from community to community, country to country, yes, there are geographical and cultural nuances, but at the end of the day, a lot of these issues that are facing dogs and cats around the world are almost identical. And a lot of times, the tools that we have in our toolkit to help address these companion animal welfare issues are also very identical, recognizing that, yes, there are some cultural and geographical differences. So looking at South Africa, again, this dog could be probably in many of the communities that you work in throughout Asia, right? So we see similar conditions affecting companion animals, be it malnutrition, be it inhumane housing practices, dogs being kept on heavy chains, dog fighting, lack of legal protection for dogs and cats, unregulated breeding, fleas and ticks, a lack of access to veterinary care, just generally speaking. I think particularly in North America, this issue of access to care and the fact that pet owners just don't have access to affordable veterinary care, that is really getting its moment right now, where I think it's something we've kind of swept under the rug for so many years. We are really taking a step back and recognizing, like, people just can't afford it. People can't afford veterinary care. It's not in their communities. They don't have vehicles to take these animals to veterinary care, and the cost of veterinary care is just astronomical. And I think to myself, if I can't afford it, if I think this is expensive, like, how do most people, and if you have 4 large breed dogs in your backyard, how are you paying for this $90 a bag dog food? So it's really hard on people. And so, again, a lot of these issues that we see in South Africa, the situation is, it's dramatic. And the reason it's dramatic from an animal welfare perspective is because of this. So while these animals could be in any community, probably in most of Southeast Asia, the economic disparity is the worst in all countries in South Africa, right? There are clear haves and there are have-nots. And it is so dramatic, and I think this photo just really clarifies that in a way that is so visually striking, that it's easier to understand when we take a step back. why some of the suffering that's happening with animals is what it is, right? Why the lack of resources is what it is. And I think sometimes it's easy to judge. Like, we all have our own personal judgments, right? But when we start to understand the challenges in these communities, we can better understand ways also to address these companion animal welfare issues. Okay, so with that being said, so I travel to a lot of different places in my role with HSI. I see a lot of our global programs and a lot of the companion animal welfare issues. But one thing that really holds true, no matter where I go in the world, is this unbreakable bond between people and their animals, right? We call them companion animals because they are just that. They are our companions. They have developed to be such over years and years. And so even in the most economically disadvantaged communities, we see this love and this bond between people and their pets. And so the question is always, well, how do we create effective interventions that take into account the local context, the challenges that are on the ground, and help the animals? And in doing so, help the people. And so I think that comes down to data, being data-driven. In the animal welfare community, we have made such strides in the last 10 years. And that it's not just about going out and spaying some dogs. Like, let's go and sterilize 100 dogs. That is not effective. We know that's not effective, right? We have to be thinking on a certain scale. We have to be impactful. And we have to really consider the data. So I'm going to turn it over to Dr. Ahmet to talk a little bit about our South Africa initiative and the type of data collection and analysis that we do in preparation for a program.
Thank you, Dr. Katherine. I think when we think of program, the first thing comes up, like as Dr. Katherine said, that there's a need for such program globally. In most communities, there is a need. But when it comes to creating a program, do we ask basic questions like, what is the need of that community? What is the need of dogs living with that community? What is required to be served? Do we also consider that, do we know exactly how many dogs we are talking about? Do we know exactly what issue we are going to solve? Can we solve it? Can we solve it in a framework of time? Can we solve the problem at the root cause? Can we solve it in a way that it is sustainable? We talk about sustainability a lot, but do we know exactly what is sustainability? So all of this, all the context can be understood well by data. So why data? Because we want to understand better the situation and based on that create a program. So whenever we talk about program in HSI globally, the first thing comes in our mind is why we want to create a program and what we trying to solve, how we will solve it, for how long it will take us to solve it. Similarly, when we were thinking about a program in South Africa, we use the same metrics, like why we are choosing this place, who will run the program, why we are going there. Based on that, based on the simple metrics, we went to a place which is Cape Agulhas municipality, a couple of hour drive from Cape Town. And that place, keeping in mind that the need for such program is not just one place or one location in South Africa, it's required everywhere in South Africa. As you saw the picture, there's clearly two communities living in the country, high income and low income, like very clear. It's nothing like a middle income, going slowly towards low income, very high income and low income. Such clear division. When there is a need all over the South Africa, why this place? Because strategically, if we can prove that such program help solve the problem in this community, we want to multiply the same program and same concept all across the South Africa. So first thing was collaboration. Cape Agulhas municipality should be part of this. Two local organizations should be part of this, should be part of when we were thinking about program, not implementing program, thinking about program. They were part of data collection. They were part of conducting survey. So that is collaboration, like taking them with us through the journey and telling that this is your program. At some point, very soon, it will be with you and you are the one who going to carry out the whole program for your own community. So when we conducted survey, household survey, free roaming dogs and cat data, we found that in particularly two communities which are marked in the red circle, which are low income, the dog sterilization, cat sterilization level was very low compared to the two communities which are above the red circle, where you can clearly see about 80%, 70% dogs are already sterilized, vaccinated, well taken care by their owners. But the communities where they cannot afford, and this is the case despite there are 2 local NGOs working from decades, and they're trying their best, but not understanding the whole concept, not understanding the whole issue at the scale or the broader scale. So we went there as an external expert, advisor, or a partner who can shape this program, hand it over back to them. More data we collected, it seems like people not wanting them dog to be sterilized, but the main reason was not having financial aid with them. So most answer were like, I don't want to sterilize my dog. I don't think it's necessary. But when we dip into that, we realize it's more about a barrier as a veterinary services, because if it is unaffordable for them, no matter how much you can talk, how much to educate them, if they can't afford it, it's impossible for them to provide such veterinary care to their pets. So some data could tell a lot. This data chart is from simple question, like how old is your dog? You can see on the, one is low-income community, one is high-income community. In the low-income community, if you look at the first 2 bar, below 1 year population is about 30%. That means in this community, dog lives shorter lifespan, the turnaround is very high, 30% population is coming every year new into that area. On other hand, if you look the high-income communities, the turnaround, a population below 1 year is just 8.6%. Dogs live longer, healthier life. And because of that, the clear difference that in one low-income community, because of lack of veterinary care and access, dogs are living shorter life, and there's a high breeding going on within the community. That is why the 2 local NGOs working from decades never reached the required sterilization scale or coverage. While in the high-income community, where people can afford, people could go to the veterinary clinic, their dogs are living longer, healthier, and less requirement for new dogs. That is what we learned. And barrier to veterinary care is one of the top problem globally because veterinary clinics run with the financial model. Owner who cannot afford have a barrier. So there are 2 types of barrier. One, veterinary clinics and veterinary community. I am myself veterinarian. A pet owner who cannot afford such services. So we need to deep dive and see what are the barriers which causing this problem. It's not simple. No matter how much we talk about it, it's very complex. We also collected data about dog bite. When it comes to dog bite, we collecting data globally, and we found it's about 5 to 8% dog bite. When we ask a question to household, like, is anyone bitten in your household in last 12 months? We generally get 5 to 8%, but in this low-income community, it was 14%. 14% people are getting bitten by a dog, mostly free-roaming dog on the street. This is serious and concerning because of zoonosis perspective, as well as a healthy community. So that is why the program name is Healthy Pets, Healthier Community. Using all the data and all the parameters we set it up, how we transform from data to program, I'm handing over back to Dr. Katherine.
Yeah, thank you, Dr. Amit. So I think that's always like the fundamental question, right? We collect data, we understand, well, how many animals are in the community, how many animals are in people's homes, what are the issues that are truly facing them, and then what do we do? Like, what the heck do we do with all this data, all of these spreadsheets? And so really transforming that into a program, I think, is an art. It's something that we've cultivated over the years, and we're still learning, right? Every program is a learning opportunity. But I think what we've learned is that, a program is not just spay-neuter, generally. A program is not generally just low-cost veterinary services. To really address an issue as complex as the issues are that we're talking about, it requires a complex approach. And so we look to integrate Again, local stakeholders, this needs to be their program. Like, we are not, as an international NGO, not looking to be in these communities for years and years and years, right? So our role really is to bring together stakeholders, find effective models, and turn it over to them. And so these were just some of the components that really came out as needing to be integrated into the program. And really looking at this from a One Health approach, because again, what do municipal leaders care about? Generally, it's not animal welfare, right? Generally, it is the health of communities. They want to get reelected. They often care about their budgets. And so how can we help decrease things like dog bites? How can we decrease things like rabies to create not only healthy animals, but healthier communities, right? That we can get more municipal buy-in. Humane education is something that I think really requires a bit more research and data on the long-term effect. I think we all that have been in this field for so long appreciate the value of humane. We know that it is an important component. South Africa is tricky, a country with 11 national languages, and so we, again, are working with local NGOs that are skilled in this and that are skilled in local curriculums. Not only looking to educate children, but to also train the trainers, train teachers, get this integrated into curriculums is what we tend to find to be far more effective. Making sure that veterinary services are both affordable and accessible, and sometimes this requires creativity, right? So sometimes this is truly bringing veterinary services into the community, working with local veterinarians. We are both veterinarians, so we both appreciate that, yes, veterinarians need to make money. Like, that is part of the equation here. But how can we do it with models that actually lower the costs while are still profitable for the veterinarian, that the community can afford? So this program specifically looks to work with local partners to bring veterinary services into the community. Fleas and ticks, I mentioned, are a huge problem. But just getting general preventative care to these animals is really important as well. And trying to find sustainable solutions. So, going and from a flea and tick perspective, just using that as an example, we can certainly spray the environment, right? We can take some Amitraz, we can spray a property, and that lasts for what, maybe a month? We could provide flea and tick dips, okay, like that's maybe a little bit better, but neither of those are very sustainable. What we need are these products to be integrated into stores, into facilities that communities can access and access at a price that they can afford. So that is something that we are working on as well. This is just my little pet peeve, so I'm gonna throw this into any presentation I give, but it is up to us, particularly professionals in this room, to set a high standard, to set a high bar. If we are not doing it ourselves, how do we expect others to be wearing caps and masks, to be sterilizing our instruments, right? Spay and neuter at the end of the day is an elective procedure, and we need to be doing more good than we are harm. And so we have spay and neuter guidelines. We'd be happy to share them with you. It could be 1 or 2 pages, right? It is minimum expectations of what we expect to make sure that we do not have high morbidity, mortality, and then again, we are doing more good than harm. Also integrating in new practices, right? Animal identification is so important for, well, not only pet reunification, but also when we're managing street animal populations, whether or not that's a tattoo, whether or not that's in the ear, whether or not that's an ear notch. We have a database at HSI. We have an app that we use to geolocate and track all of our surgical procedures and animals that are involved. And so that doesn't have to be as fancy. It could be as basic as just making sure that we're identifying animals that go through our programs. One thing that we've learned is that, yes, we can invest in digital advertising, we can get Facebook ads, we can have a Facebook page, but I think the most effective communication tool that we truly have, particularly in some of these lower resource communities, is word of mouth. Like, you create a buzz, and they are gonna be, the people in that community will be your #1 advertisement tool. Just a quick video that was created for the community that we worked in, and we'll see if we can get this to work. I'm not sure how to. Am I controlling this or you? Okay, I think we're like fighting for control here. Yeah. So this is obviously one program in one community in one country, right? And so I think it always lends the next question of, like, how do we scale this up, right? Because we need to be more impactful. So as Dr. Amit was saying, I mean, we're looking to create sustainable models that then governments themselves recognize the value and can recreate themselves across the country. Just a few take-home points, because I know that was a super high overview. But I think data is really critical whenever we develop an intervention. We need to know the problem at hand, the scale of it, to really be able to craft an effective solution. And we needed to be always measuring our impact. I know there wasn't a lot of time in this presentation, but we're looking to measure each and every step in all of these activities, right? They need to mean something. We need to be questioning why we're doing something, not just do it because, well, we can do it, right? Community ownership is so important. It's not just about going out and doing education. It is making sure that we have buy-in and community ownership of this program, right? So that, again, these programs are sustainable and move on no matter where we are in the world. And that, again, just another shout out for veterinary standards, because it sets a precedent, right? It sets a precedent. It sets a community perspective and understanding of the quality of the work that you do, and it gets community buy-in. And if animals are going home with incisional infections and are dying, that is not good for community, for the reputation of the organizations involved or the program. So just really important that that is always first and foremost in our minds when we are developing an intervention. I will say that Humane Society International, we do have an entire department, as I mentioned, that is focused on monitoring and evaluation, and we are more than happy to work with each and every one of you, obviously capacity depending, but to help, talk about how do we measure our programs, what does data collection look like, what do dog surveys look like, is there technology to help facilitate that? And last but not least, I'm going to do a cheeky promo here for Animal Care Expo, which is a conference that is hosted by HSI and Humane Society of the United States. That's going to be in Texas this coming year, in 2024, and there's discounted registration. So if any of this type of work or topics interest you, by all means, please check it out on the HSUS or the HSI website. Thank you.